and re-emerging disease like diphtheria, etc. And he has 12 years teaching experience. He got Active Pediatrician Award 2006, Best Doctor Award by Government of Tamil Nadu 2016. He is very much interested in community service through IAP as well as through Rotary. Thank you.
Good morning, respected Chairperson, senior professors, and my dear colleagues and the postgraduates. Very good morning to all. At the outset, I thank the IAP TNSC office bearers as well as the organizing committee of this wonderful program, Puduvai Pedicon, for giving me this opportunity. So, எல்லாரும் ரொம்ப சந்தோஷமாக 2 ஆண்டுகளுக்கு பிறகு இது மாதிரியான ஒரு in-person மீட்டிங்கில் கலந்துட்டு இருக்கோம். So I think we are all enjoying, hope you are all enjoying. And so I'll go on to the topic. So 50 years ago, when the Surgeon General of US, William Stewart, thought that the battle against the infectious diseases was over, and he proposed to the government the diversion of funds for chronic diseases. He was surprised to see a medical resident applying for internship in infectious diseases. He is none other than Dr. Anthony S. Fauci. He is the head of the Department of Allergy and National Institute of Allergy and Infectious Diseases. So all of us know the impact of COVID-19 in the whole world now. Even it is not over, it is still controlled. And so definitely this talk will be just to create an awareness among the participants, the importance of the various emerging and re-emerging diseases. I may not be able to cover the entire gamut of diseases, but I'll try to brief about certain diseases, not going into much of the clinical presentations or the lab diagnosis or the management. So these are my objectives. Why the need for awareness? The pediatricians and emergency providers are at the forefront of recognition and treatment of the novel and re-emerging infectious disease in children. Familiarity should be there with the disease presentations. Some of the vaccine preventable diseases are not seen nowadays and they come back again, so we have to be familiar with the presentations as well as certain diseases from non-endemic areas when they come to our country. And then certain diseases may have unique patterns in children, and in the wake of the globalization and international travel, we may have children coming from history of travel from abroad. So what is an emerging infectious disease? A new or not experienced in the community, a new disease like novel coronavirus, or with new features, the introduction of a disease to a new location. For example, I can say that when dengue was there in Chennai in 92, we had the experience of this dengue in 2000. So new location like Kanyakumari district was experiencing dengue in 2000 after 10 years. And then the resistance to treatments like the MDR TB or the falciparum, or the chloroquine resistance falciparum, and rapid increase in the incidence, sudden rapid increase in the incidence and spread of diseases like Chikungunya or swine flu, and some diseases emerge in areas undergoing ecological transformation like the Lyme disease in the United States. And what is a re-emerging disease is one which has been controlled or rather eliminated, which appear again, like the repeated episodes of influenza, repeated attacks, and then the Chikungunya after so many years, so many decades, it came back in 2006, and diphtheria, which was very low, but then came again a resurgence in 2011 to 15. So it's a timeline of emergency diseases worldwide. We had the 2000 dengue, and then various other diseases like the West Nile and Chikungunya in 2005, swine flu 2009, and then the Ebola in 2013 to 16, MERS in 2012, and the latest one being COVID-19. This is again a slide showing the various centuries, the emerging infections across India. The 19th century we had the cholera and plague, and then 20th century we had the polio, the smallpox, even though they are eradicated, polio eradicated regionally, and then cholera, plague re-emerged, and then SARS, and this 21st century we have the Chikungunya, swine flu, Nipah, Zika, and COVID. Again, another slide showing the various diseases in the various part of our country. A lot of factors responsible are, depending on the agent host and the environment. The microbial agent is a constant fight between the agent and the human race. So who is superior? So they try to adapt. Even now we see we are trying to eradicate COVID, but it comes again with newer variants. It adapts, they shift and drift, and then the human demographics and the behavior that people, including into the forest area, getting exposed to so many vectors and newer diseases. And then the eating habits, we saw that in Wuhan market they showed all the so much of meat and flesh, and so the behavior of human beings definitely play a role. And the international trade and travel, which I already told that previously last century it took about 36 hours to travel the globe, but now it takes just 36 hours. 1 year to travel the globe last century, now only 36 hours. So it's all very easy to spread the disease from Africa or America to India. And then the inappropriate use of antibiotics. The climate and weather, we all know that the recent flooding and the weathers are changing. The climatologist has announced that there will be a warming of the global temperature by 3 degrees, and so we naturally expect a lot of the vector breeding sources, and then the lack of public health services which get disrupted often, and the water supply, sanitation, and then the vaccines. So much issues are there. They all play a major role in the emergence or the re-emergence of diseases. An important point to note is most of the diseases which have emerged, or majority of them, are zoonotic in origin, that is the man to the animals and animals to man, and then the 40 or 50% of the newer organisms are viral in origin. These are the pictures showing the common vectors, the ticks, fleas, mites, and the mosquitoes, and then the rodents like the rats and the pigs and the flying, these bats, and so many things. So this is about H1N1. All of us are very familiar with the influenza, which is there throughout the world. 90 million children are affected every year, and about 25% of them have LRI. And then about H1N1, it has affected the children also, mostly because the comorbid conditions in children, or immunosuppression produces more severe disease in children. And then there is a human-to-human transmission. The COVID-19, all of us are well aware, so I'm not going to the details. This is about the variants. Alpha was in Jan 20, and then now the latest one being the Omicron is in December 21. Nipah virus, all of us are very familiar with this virus because it had a resurgence in Kerala. It produced an ARI and then the severe respiratory distress and then encephalitis like features. It spread through a direct transmission from the fruit bats or the pigs to human beings, or an indirect spread when consuming the palm syrup or the date palm juice and food items. The major outbreaks have occurred even before that, 2000 and 2007. The Bangladesh and Indian border, there's a Nipah belt is there. So initially they suspected the patients who got affected in Kerala had they come from Bangladesh, but it's not so. So they have identified the virus in the fruit bats. A high fatality rate was there in Nipah. And then Zika virus, again it caused concern in Brazil in 2015-16 when there was an epidemic of microcephaly among children, and the World Health Organization announced it as a public health international emergency concern. And it is caused by another virus, and it is transmitted by vector as well as the non-vector route, like the sexual transmission as well maternal to child, and drugs, injectable usage like that. And it causes microcephaly and then the congenital Zika and Guillain-Barré syndrome. Dengue, all of us are very familiar. Even yesterday, Dr. Thangavelu sir has highlighted the importance of diagnosing dengue at the primary care level. All of us know it is there in the nook and corner of our country. There is a hyper-circulation, hyper-endemic situation where all the serotypes are circulating in the country. Even Tamil Nadu, we have repeated episodes of dengue. It was innocuous, a mild infection in 1950s, and then afterwards it changed its picture to dengue hemorrhagic and shock syndrome, and it got the attention. Now it is a very severe illness. Even now we have epidemics in Kanyakumari district also. Then Chikungunya, all of us are very familiar with disabling disabling arthritis it produces in human beings. Even children were affected. It is there in all the states, mostly 22 states and union territories of India. And malaria, no need to mention about the resistant strains, especially to the drugs, chloroquine. This is a picture showing all the pink color falciparum endemic areas, and blue there is not much reported of transmission of falciparum, but most of them are having a 10% increase in the resistance to chloroquine. Then some of the virus like the Chandipura virus, which had an outbreak in Andhra Pradesh in 2003, and another one is acute encephalitis syndrome in UP and Bihar. Currently we see in the newspapers that there is an epidemic of encephalitis among children. JE is detected in 15%, and then cholera, I put a slide on cholera because when I was a student, we had visited the Tandayarpet hospital where we saw cholera cases, but now we are not thinking about cholera because of the improvement in sanitary conditions, water supply, but still the warning is we have too much of flooding and waterlogging nowadays. Within few days, waterlogging is there, so there may be outbreaks of cholera in future also. And Crimean Congo hemorrhagic fever had an outbreak in Ahmedabad. Is again a hemorrhagic fever. And Ebola, not so far reported in our country, but is a cause of hemorrhagic fever. It was there in the African countries. And rickettsial diseases, most of us are very familiar because previously we never had such a diagnosis of scrub typhus and many other diseases like the spotted fevers and the typhus. But nowadays it has become a routine investigation to rule out rickettsial diseases in a day-to-day practice. The scrub typhus being spread by the shigas, and this is one of the pictures I wanted to show about the SR. It's present in about 50 to 80% of the cases, and I'm not going to the details. And about the re-emergence of vaccine-preventable diseases. We now see that during the previous century, we had the expanding arsenal of childhood vaccines, and along with the antibiotics, we were able to reduce the burden of vaccine-preventable diseases. But today, we are in a situation where we have the vaccine hesitancy as well as the refusal by the public. Many places, even the NFHS 5 says that the fully immunized coverage is less, it's declining. So there is an important role for the pediatricians to play, and we have to address the role of vaccine hesitancy and refusal as well as to inform the public authorities about the emergence of such an outbreak of a vaccine-preventable disease, because we are going to treat the child. So we have to be familiar and we have to report, especially with regard to diphtheria. Ever since the EPA, the expanded program immunization was done in the 80s, we had a very great decline in the incidence of diphtheria, but to our surprise, again it emerged in 2004, and now also we have cases of diphtheria. So any child with fever and sore throat, definitely we have to look the throat where you see for the patches. And the most important thing to note here is the shift of the age group from the young children less than 5 years to the adults, adolescents as well as the adults. And because of the waning immunity as well as the resistant strains also are coming up. And then, so this is a picture I want to show. The cutaneous diphtheria is one of the factors responsible for the silent transmission of diphtheria. This is another graph showing that even with a good coverage, we have still in 2018 also cases reported. And then pertussis also same thing. It has shifted the age group from adolescents to from the young age to the adolescents and adults. So the measles is a very important thing to note that measles, the natural host is only human beings. We have a very good vaccine, but still we are not able to eliminate measles, even though we have the sustainable development goals to eliminate measles. And this is a picture showing that in the year 2019, almost all countries, the developed and developing countries, reporting lots of cases of measles. And this is a small picture. It's not for a pediatrician or a emergency provider, just go by the symptoms and suspect some of the emerging or the re-emerging infections. like with the ARI and fever, with dyspnea, respiratory difficulties. Nowadays, anybody will suspect this COVID-19 as well as the influenza. And then predominantly with the CNS symptoms, we have to always roll out the JE as well as the Nipah and the West Nile fever. And fever with joint pains, myalgia, we have always suspect with microcephaly, Zika, and then with the shock, thrombocytopenia, hemorrhage and shock, we suspect dengue, and then arthritis, chikungunya. And then with the fever, headache, myalgia, and then with the hemorrhagic picture, we have to always suspect multi-organ dysfunction as well as the ARDS and shock. We have to suspect this Crimean hemorrhagic fever as well as the other fevers. This is about the prevention, how to prevent these diseases. Vector control is very important. And then the environmental and personal hygiene and immunization coverage. We have to be very, very given stress on the immunization coverage. We cannot be slack in it. Whatever vaccines available, we try to give to the children. Even the mosquito, malaria, they are having the vaccine in Africa, Muscorix, as well as the COVID vaccines are going to come for children. And then the public health awareness, to the people we have to give awareness, and then the surveillance, especially the IDSP as well as the GOAN networks, Global Outbreak Alert Response Network is there. So we have to report, that is the most important thing. We have to have a database about these diseases, and then the research activities with the veterinariologists as well as the environmentalists and agriculturists, we have to identify the various diseases. And take-home message will be, our understanding of the emerging and re-emerging diseases continues to evolve rapidly, and there are guidelines being issued by WHO as well as the Indian government. So we have to follow the guidelines, how to manage, how to diagnose, diagnose and treat these children, plan appropriate isolation of children. If there is a suspicious of an emerging disease, a new disease, it always plan for isolation of the children, proper testing and identification of children who need more aggressive management and reporting. And children with recent travel, kindly think about the non-endemic disease. It may not be there in our country, so mostly tropical infections. And I thank you once again for the patient listening. Thank you very much.
Thank you, Professor. We're finishing in time. Thank you, thank you.
Thank you, the chairperson and the speakers, Dr. Ramesh Babu and Dr. Suresh Balan, talking about the most important hot topic of the tropical season now. I request Dr. Pa Rajendran